Question 1. The nurse is monitoring a client who is receiving oxytocin to induce labor. Which assessment findings would cause the nurse to immediately discontinue the oxytocin infusion? Select all that apply. 1. Fatigue. 2. Drowsiness. 3. Uterine hyperstimulation. 4. Late decelerations of the fetal heart rate. 5. Early decelerations of the fetal heart rate. Explanation. Question 1. Rationale. Oxytocin stimulates uterine contractions and is a pharmacological method to induce labor. Late decelerations, a non-reassuring fetal heart rate pattern, are an ominous sign, indicating fetal distress. Oxytocin infusion must be stopped when any signs of uterine hyperstimulation, late decelerations, or other adverse effects occur. Some obstetricians prescribe the administration of oxytocin in 10-minute pulsed infusions rather than as a continuous infusion. This pulsed method, which is more like endogenous secretion of oxytocin, is reported to be effective for labor induction and requires significantly less oxytocin use. Drowsiness and fatigue may be caused by the labor experience. Early decelerations of the fetal heart rate are a reassuring sign and do not indicate fetal distress. Test-taking strategy. Note the strategic word, immediately. Focus on the subject, an adverse effect of oxytocin. Options 1 and 2 are comparable or alike and can be eliminated first. From the remaining options, recalling that early decelerations of the fetal heart rate are a reassuring sign will direct you to the correct options. Question 2. A pregnant client is receiving magnesium sulfate for the management of preeclampsia. The nurse determines that the client is experiencing toxicity from the medication if which findings are noted on assessment. Select all that apply. 1. Proteinuria of 3. 2. Respirations of 10 breaths per minute. 3. Presence of deep tendon rerexes. 4. Urine output of 20 milliliters in an hour. 5. Serum magnesium level of 4 milliequivalent/L, 2 millimoles per liter. Explanation. Question 2. Rationale. Magnesium toxicity can occur from magnesium sulfate therapy. Signs of magnesium sulfate toxicity relate to the central nervous system depressant effects of the medication and include respiratory depression, loss of deep tendon reflexes, and a sudden decline in fetal heart rate and client's heart rate and blood pressure. Respiratory rate below 12 breaths per minute is a sign of toxicity. Urine output needs to be at least 25 to 30 milliliters per hour. Proteinuria of 3 is an expected finding in a client with preeclampsia. Presence of deep tendon reflexes is a normal and expected finding. Therapeutic serum levels of magnesium are 4 to 7.5 milliequivalent/L, 2 to 3.75 millimoles per liter. Test-taking strategy. Focus on the subject, magnesium toxicity. Eliminate option 3 first because it is a normal finding. Next, eliminate option 5, knowing that the therapeutic serum level of magnesium is 4 to 7.5 milliequivalent/L, 2 to 3.75 millimoles per liter. From the remaining options, recalling that proteinuria of 3 would be noted and expected in a client with preeclampsia will direct you to Question 3. The nurse asks a nursing student to describe the procedure for administering erythromycin ointment to the eyes of a newborn. Which student's statement indicates that further teaching is needed about administration of the eye medication? 1. I will rush the eyes after instilling the ointment. 2. I will clean the newborn's eyes before instilling ointment. 3. I need to administer the eye ointment within 1 hour after delivery. 4. I will instill the eye ointment into each of the newborn's conjunctival sacs. Explanation. Question 3. Rationale. Eye prophylaxis protects the newborn against Neisseria gonorrhoeae and chlamydia trachomatis. The eyes are not flushed after installation of the medication because the flush would wash away the administered medication. Options 2, 3, and 4 are correct statements regarding the procedure for administering eye medication to the newborn. Test-taking strategy. Note the strategic words, "Further teaching is needed." These words indicate a negative event query and ask you to select an option that is an incorrect statement. Eliminate options 3 and 4 first because they are comparable or alike and relate to instilling the eye medication. From the remaining options, visualize the effect of each. This will direct you to the correct option. Question 4. A client in preterm labor, 31 weeks, who is dilated to 4 centimeters has been started on magnesium sulfate, and contractions have stopped. If the client's labor can be inhibited for the next 48 hours, the nurse anticipates a prescription for which medication? 1. Nalbuphine. 2. Betamethasone. 3. Rogaine, immune globulin. 4. Dinoprostone vaginal insert. Explanation. Question 4. Rationale. Betamethasone, a glucocorticoid, is given to increase the production of surfactant to stimulate fetal lung maturation. It is administered to clients in preterm labor at 28 to 32 weeks of gestation if the labor can be inhibited for 48 hours. Nalbuphine is an opioid analgesic. Rho-D, immune globulin, is given to Rh-negative clients to prevent sensitization. Dinoprostone vaginal insert is a prostaglandin given to ripen and soften the cervix and to stimulate uterine contractions. Test-taking strategy. Focus on the subject, a client at 31 weeks gestation. Recall that the preterm infant is at risk for respiratory distress syndrome because of immaturity and the inability to produce surfactant. Next, recalling the actions of the medications in the options and that betamethasone is used to increase the production of surfactant will direct you to the correct option. Question 5. Methylergonavine is prescribed for a client to treat postpartum hemorrhage. Before administration of methylergonavine, what is the priority assessment? 1. Uterine tone. 2. Blood pressure. 3. Amount of lochia. 4. Deep tendon rerexes. Explanation. Question 5. Rationale. Methylergonavine, an ergot alkaloid, is used to prevent or control postpartum hemorrhage by contracting the uterus. Methylergonavine causes continuous uterine contractions and may elevate the blood pressure. A priority assessment before the administration of the medication is to check the blood pressure. The obstetrician needs to be notified if hypertension is present. Although options 1, 3, and May 4th be components of the postpartum assessment, blood pressure is related specifically to the administration of this medication. Test-taking strategy. Note the strategic word, priority. Eliminate options 1 and 3 first because they are comparable or alike and related to one another. To choose from the remaining options, use the ABCs: airway, breathing, and circulation. Blood pressure is a method of assessing circulation. Question 6. The nurse is preparing to administer exogenous surfactant to a premature infant who has respiratory distress syndrome. The nurse prepares to administer the medication by which route? 1. Intradermal. 2. Intratracheal. 3. Subcutaneous. 4. Intramuscular. Explanation. Question 6. Rationale. Respiratory distress syndrome is a serious lung disorder caused by immaturity and the inability to produce surfactant, resulting in hypoxia and acidosis. It is common in premature infants and may be due to lung immaturity as a result of surfactant deficiency. The mainstay of treatment is the administration of exogenous surfactant, which is administered by the intratracheal route. Options 1, 3, and 4 are not routes of administration for this medication. Test-taking strategy. Focus on the subject, route of administration for exogenous surfactant. Note the relationship between the diagnosis, respiratory distress syndrome, and the correct option, intratracheal. Question 7. An opioid analgesic is administered to a client in labor. The nurse assigned to care for the client ensures that which medication is readily accessible in the event that respiratory depression occurs. 1. Naloxone. 2. Morphine sulfate. 3. Betamethasone. 4. Hydromorphone hydrochloride. Explanation. Question 7. Rationale. Opioid analgesics may be prescribed to relieve moderate to severe pain associated with labor. Opioid toxicity can occur and cause respiratory depression. Naloxone is an opioid antagonist, which reverses the effects of opioids and is given for respiratory depression. Morphine sulfate and hydromorphone hydrochloride are opioid analgesics. Betamethasone is a corticosteroid administered to enhance fetal lung maturity. Test-taking strategy. Focus on the subject, the antidote for respiratory depression. Eliminate options 2 and 4 first because they are comparable or alike and are opioid analgesics. Next, eliminate option 3, knowing that this medication is a corticosteroid. Question 8. RHUD. Immune globulin is prescribed for a client after delivery, and the nurse provides information to the client about the purpose of the medication. The nurse determines that the client understands the purpose if the client states that it will protect the next baby from which condition? 1. Having Rh-positive blood. 2. Developing a rubella infection. 3. Developing physiological jaundice. 4. Being affected by Rh incompatibility. Explanation. Question 8. Rationale. Rh incompatibility can occur when an Rh-negative birthing parent becomes sensitized to the Rh antigen. Sensitization may develop when an Rh-negative birthing parent becomes pregnant with a fetus that is Rh positive. During pregnancy and at delivery, some of the fetus's Rh-positive blood can enter the client's circulation, causing the client's immune system to form antibodies against Rh-positive blood. Administration of Rho-D immune globulin prevents the client from developing antibodies against Rh-positive blood by providing passive antibody protection against the Rh antigen. Test-taking strategy. Note the subject, the purpose of Rho-D immune globulin. Noting the relationship between the name of the medication, Rho-D immune globulin, and the word incompatibility in the correct option will direct you to this option. Question 9. Methylergonavine is prescribed for a client with postpartum hemorrhage. Before administering the medication, the nurse would contact the obstetrician who prescribed the medication if which condition is documented in the client's medical history. 1. Hypotension. 2. Hypothyroidism. 3. Diabetes mellitus. 4. Peripheral vascular disease. Explanation. Question 9. Rationale. Methylergonavine is an ergot alkaloid used to treat postpartum hemorrhage. Ergot alkaloids are contraindicated in clients with significant cardiovascular disease, peripheral vascular disease, hypertension, preeclampsia, or eclampsia. These conditions are worsened by the vasoconstrictive effects of the ergot alkaloids. Options 1, 2, and 3 are not contraindications related to the use of ergot alkaloids. Test-taking strategy. Focus on the subject, the purpose, action, and contraindications of methylergonavine. Recalling that ergot alkaloids produce vasoconstriction will direct you to the correct option. Question 10. The nurse is monitoring a client in preterm labor who is receiving intravenous magnesium sulfate. The nurse would monitor for which adverse effects of this medication. Select all that apply. 1. Flushing. 2. Hypertension. 3. Increased urine output. 4. Depressed respirations. 5. Extreme muscle weakness. 6. Hyperactive deep tendon rerexes. Explanation. Question 10. Rationale. Magnesium sulfate is a central nervous system depressant and relaxes smooth muscle, including the uterus. It is used to halt preterm labor contractions and is used for preeclamptic clients to prevent seizures. Adverse effects include flushing, depressed respirations, depressed deep tendon reflexes, hypotension, extreme muscle weakness, decreased urine output, pulmonary edema, and elevated serum magnesium levels. Test-taking strategy. Focus on the subject, adverse effects of magnesium sulfate. Recalling that this medication is a central nervous system depressant that relaxes smooth muscle will assist you in choosing the correct options.